valuable. All right, so as I start to see people coming in, I would love to get a sound check from somebody while I'm setting up on Facebook. Can I get a yes, Carmen? We can hear you. Video and audio are good. I'm hoping that Facebook wants to cooperate with me today. It's a hit or miss. Either way, we're recording and we will be sending out the replay. So as a reminder, everyone, the Q&A is on the bottom of the Zoom screen. So please, please make sure you put your questions in there. Hold on a moment. Here we are. It looks like it's going to work for us. Fantastic. Dr. Al, yay. I'm so excited about this today. So let's make sure we get one more good streaming key going here. And I'm going to check back into the chat. Oh, look at everybody. Hi. Still waiting for someone to tell me that you can hear me. So if I can get a thumbs up from one of the people in the chat, that would be great, from one of you attendees. All right, thank you so much. I appreciate that. Thank you, Lydia and RC. Great. Looks like we are streaming live successfully on Facebook, and here we go. I'm so excited, you guys. I'm so excited to bring Dr. Al Danenberg to you guys today, and I have interviewed him before. We were just talking about that, but I'm going to do a real brief introduction, even though your bio is impressive. We're going to get into quite a few things that are on there. So Dr. Danenberg goes by Dr. Al. He is a periodontist and was in private practice for 44 years. He incorporated ancestral nutrition and lifestyle with his leading edge laser protocol to treat periodontal disease. In September 2018, he retired from the active practice of treating individual patients. However, Dr. Al still consults with patients all over the world virtually regarding nutrition, lifestyle, oral and overall health, and the importance of a healthy gut and immune system. In 2015, he was appointed to the faculty of the College of Integrative Medicine and created the college's integrative periodontal teaching module. Dr. Al was appointed the chair of the Periodontal Committee for the International Academy of Biological Dentistry and Medicine. And in August 2020, he published 2 mini ebooks on Kindle, Better Belly Blueprint and Is Your Gut Killing You? And so we're going to talk a little bit about your journey, and I don't even want to introduce that yet, but Dr. Al, thanks so much for being with us today. I'm so happy to have you once again talking to us about your experience.
Actually, this is my pleasure. So thank you for inviting me and giving me an opportunity to spew my ideas all over the world.
Absolutely. So we're going to start out with, as a reminder to everyone, we're talking to the general public today. And I want to keep these things, this information we're sharing with people in terms that people can understand, as well as providing nice little snippets of action steps that maybe they can take to improve their oral health at home. But we have to start with the basics here. Tell us what it means to practice biological dentistry and holistic dentistry. A lot of people don't even know it exists.
Well, first of all, and unfortunately, this is not a specialty of dentistry. So any dentist that is licensed as a dentist in their state, in the United States, can call themselves a biological dentist or a holistic dentist without ever taking 10 minutes of a course. And that's unfortunate.
Yes.
So there are organizations that produce a variety of certification programs, but it's not a legal certification, and states don't recognize that certification. So unfortunately, people can say what they think tells the public that they are a biological dentist, but they may not be. So unfortunately, that's the case, but there are a lot of good questions that you could ask a dentist. You know, you need to interview your dentist to see if you really want that person putting your trust in them and putting anything that they have to offer in your mouth. Anything that goes in your mouth, especially inside a tooth, is there 24 hours a day, 7 days a week, forever until that tooth falls out or that restoration breaks down. And if it is not compatible to your biological makeup, it will pour out whatever toxic elements it will pour out 24 hours a day, 7 days a week. It's going to affect you even if there is no study that is published that says this material will cause this kind of harm. It certainly could be harmful.
Right.
So what is a biological dentist? A biological or holistic dentist should take a series of continuing education programs to understand that the mouth is not an island unto itself, and that the mouth relates to the body and the body relates to the mouth. Every cell in the body communicates with every other cell in some fashion, in some way. And many dentists have treated their patients as if nothing affects it medically, and that the mouth doesn't affect the rest of the body medically. And that's not the case.
Isn't that crazy?
It is
Isn't that
crazy.
just, and I'm so glad you said that, because I think one of the things that's missing from, you know, helping people with their health, as us health coaches do, but and practitioners, is that people think that everything is isolated. I mean, they think the mind and the body, that for the longest time, that they didn't correlate with each other, right? It just blows my mind how people separate pieces of the body and don't understand how they intricately affect each other.
This is true, and a lot of, unfortunately, supplements that are manufactured today and are sold to the public in amazing numbers have very little benefit and a lot of harm to the body, because they're isolated substances that are not integrated with what they, how they occur naturally. And this is the concept. You know, take a pill and it'll solve this problem, and that's not the way it works.
No, absolutely not. So when you were just saying a moment ago, you were talking about, you know, what's in your, and you know a lot about my oral health and the things that I was very open and vulnerable with, what the things that I've dealt with in my life, right? The fillings, the root canals, the lost teeth from dentist breaking 5 of my teeth at one point. Ceramic implants, you were so helpful with that. Thank you so much for that information. It was a $30,000 investment to get them, but it was, you were in my mind the whole time. So let's talk about restorations for a moment. When you say restorations, are we talking about root canals? Are we talking about crowns, implants, things like that?
Yes, anything that restores the integrity of a tooth that's broken down for whatever reason is a restoration of some type. You know, like you restore a house that is broken down, you fix it. So restorations are the essence is to repair the tooth so that it can function normally, naturally, as it did before any breakdown or decay or anything like that.
Okay.
So that would be, yeah, that would be a general term, right?
Okay, so let's start with fillings. Let's start with the basic. Actually, you know what? Let's start with kids. Let's start with kids for a minute, okay? Because I want to tell you, the looks I got when I refused to let them paint my child's teeth with fluoride were not pleasant. And when I told him he was brushing his teeth with soap, that was a whole other ball game, right? Bronner soap. So let's talk about the kids for a minute. What is dangerous about painting children's teeth with fluoride?
Well, fluoride is dangerous. It's a
I know that.
neurotoxin.
You tell us why.
You're putting a neurotoxin in the body. Would you paint the teeth with lead? I mean, you know, would you, Rust-Oleum, when you paint a piece of metal with Rust-Oleum that is rusted, it may look better, but the rust is still under it. And even if the rust is not under it, if the Rust-Oleum peels off, then rust gets in it. It's just a barrier. It's not natural, although fluoride is a natural mineral or element in our environment. And in that case, it's not a bad thing if it's at a low level, as other minerals would be. But the fluoride that is provided in dental products is a chemical barrier that is neurotoxic. As a matter of fact, there was a landmark trial in federal court just this June of this year for the first time, bringing up the fact that fluoride is a neurotoxin with much proof. And the EPA now has to respond to that and come back and probably change its approval of fluoride in water.
Wow.
So it is a dangerous element in so many biological ways. But in a tooth, there's no reason that humans have decay. You know, if you look at animals in the wild, there's no decay. Well, there's no chronic disease either, and a variety of other things that we can talk about. But there's no tooth decay and there's no periodontal disease. Very interesting. Now, if you look at domesticated cats and dogs, they're loaded with tooth decay and periodontal disease.
Yes.
All you have to do is look at the bag of food and the first 3 ingredients. They're generally grains and other products that are not part of their natural diet. And this is part of our problem. Why do we have tooth decay? We have tooth decay because we're eating added sugars all the time. And if you don't think we are, take a look at one of the processed food bags and look at the ingredients, and you'll see a variety of names that are basically sugars. And sugars feed the potentially pathogenic bacteria create an overabundance and will actually create acid that demineralize a tooth or cause what's called tooth decay. If those added sugars are not there, you will not have tooth decay. End of story. There was a study that was reported in the Journal of Dental Research, I think something like 2015 or whatever. It showed, it was a meta-analysis, meaning it studied and reported on several studies that were done previous to that report, that added sugars are the cause of dental tooth decay because of what I just said about what they do to the bacteria, and that's what produces the acid. And if the sugar was not there, then there would not be decay. Starches are not causing tooth decay unless they're combined with added sugars. This is very important. If you can change your diet, and that is critical for the gut microbiome, which we can get involved with because everything starts in the gut. So the gut microbiome causes the bacteria in the mouth, which are healthy normally, if and when they get disturbed by the gut bacteria, then potentially pathogenic bacteria grow. We are eating a bad diet that actually feeds this potentially bad bacteria to grow much larger, and then we develop tooth decay as well as gum disease.
Okay, so talk about the gut biome for a moment, and let's make sure we're using. I know, like, people are like, "What's a biome?" So let's talk about the gut biome and the mouth biome. Talk about those two things for me.
So the biome is a garden of bacteria. So your mouth has a garden of bacteria. Take a look at your garden outside. There are lots of microbes in the soil. There are a lot of plants that are growing in the wonderful dirt that you have made for these plants to grow. So in your mouth, you have this beautiful garden of bacteria. Potentially, everyone has maybe 200-300 species. You may have anywhere of 700 different species that are in existence. And you have a gut microbiome with even more species in your gut that live there in relationship to creating benefits for your body. We have 38 trillion microbes in our body, and we only have 30 trillion human cells. Think about that. We are more microbial than human cells. That's amazing. If you were to sterilize your gut, thinking, oh my God, I don't want to have bugs growing in my gut, I'm going to take an antibiotic every day just to make sure that I kill all these bugs, you'll die. You will absolutely die. If you sterilize the bacteria in your mouth, you will destroy the health of your mouth and other biological functions. And we do that every day. We use mouthwash every day that's antibacterial, antimicrobial. We're killing the garden of bacteria every day that interferes with all the normal biological functions in the mouth and the rest of the body. Very harmful.
Yes, I agree. So, Listerine and all of these commercial mouthwashes, I mean, just toxic and terrible for you anyway. But I want to go back for a moment. When we use the word neurotoxic, in my mind, I think about the thyroid, we personalize things, right? I think about the thyroid. I think about fluoride blocking the thyroid receptors from letting that thyroid hormone in. So we have a good metabolic rate in our body, works properly. Can you give us a little bit more about what neurotoxic means and share that with us?
Neurotoxic is damaging nerve tissue and it's other factors too, but nerve tissue is damaging nerve tissue is a neurotoxic agent. There are studies that have shown and proven, especially in this trial that just completed, like I just mentioned, that prove that fluoride in water or other elements or other means to get into the body can decrease the IQ of children, especially damaging fetuses and infants, more so than adults, but definitely. In the thyroid, for example, the fluoride ion replaces iodine, which is part of the thyroid hormone, and it affects the function of the thyroid gland. So these are just two of many, many factors that fluoride can damage. The
Yeah.
idea to harden the root of the tooth, which fluoride will do, it'll harden the root of the tooth, is so minimal compared to its potential toxic responses to the body.
Mm.
And if you only understood how to, number one, eat it, number two, how to clean fluoride.
Oh, we've got a little breakup going on here. Hold on just a moment. Okay, I think we're back on. Oh, wait a minute. You're freezing up. How are we doing on your side, Dr. Al? You good?
Everything looks good to me.
Okay, good. Okay. Go ahead.
It is what it is, right?
It
The
is what
internet.
it is. It's technology, right? Okay, I think I've got a full signal on your end,
Yeah.
and I'm full on mine, so we should be good. Okay, go ahead and
Okay.
speak, and let me
Where
check
did
your signal.
you stop listening to me? Yeah, I can speak.
Yeah, hold on. Yep. Okay, I see you. You were just talking about the multitudes of neurotoxicity. That's just a couple of things. You explained the ion replacement in the thyroid. Yeah, so
Sure.
neurotoxicity in general. Yeah.
Yeah, so I mean, why put something in your body that you know is toxic? Studies are everywhere. Medical studies are everywhere proving this, not only in studies, but in
We're
like,
having some problems. Technology here. We've got some problems. You're breaking up on your end. Hold on just a moment. Let me do a check. I've got full signals on my side, and everything is streaming well on that end. Have you got a signal mark on your side? It looks yellow on my side for you.
no, and it doesn't say anything about the signal being weak, so I
That's
don't know.
crazy.
I'm
Let's
sorry.
just keep plugging along. That's okay. This is the way this is life online, right? Yeah.
Yeah.
Okay.
So in essence, why put a toxic element in your body if you know it's toxic?
Yeah.
Come on, let's be realistic. Let's get rid of all the irritants that we have control over that can affect our body.
Right. How did it get in our water in the first place?
Well, it's been done. It's been man produced. I mean, it's a toxic element. You know, some of the studies showed that fluoride can prevent tooth decay, so they threw it in the water. And it never really can work that way. For example, how many glasses of water do you drink? Another person may drink 3 times the amount of water. That means they're getting 3 times the dose. What is the normal dose if there is a normal dose?
Right.
So fluoridation in water probably has never really been beneficial.
Yeah.
There are other confounding situations that may look like the fluoride in the water prevented tooth decay, but it's not a well dosed element. So it makes no sense whatsoever.
I agree. So if a parent were, just starting out with their child, brushing their teeth, I remember the days when I had an infant, and I remember the little brusher on your finger and all that good stuff. And I remember very early on, giving him toothpaste without fluoride, without sugar. He didn't understand why he had to have the yucky toothpaste, mommy, when everyone else had the orange toothpaste, right? I remember all of that. And I don't know if it was an instinctual thing for me. But can you give us some thoughts and ideas on how a parent can be proactive about their child's oral health before they even get into all this other stuff, right?
Well, I just mentioned it, and I'll just keep repeating it. Diet is critical. So if you don't
Yep.
understand the diet, I don't care how you're trying to brush or clean a person's mouth, you're going to create a unhealthy oral environment, no matter what. If you can't understand how to make your gut garden of bacteria healthy, you will have an unhealthy oral environment. But let's assume you understand these things and you're taking care of that in one way or another. How do you clean your mouth? Well, toothpaste is totally unnecessary. Absolutely unnecessary. A soft bristle nylon toothbrush is all you need to brush your teeth with filtered water, for example, is perfect. If you wanted to use a little bit of water with maybe a dash of Himalayan salt, that's perfectly good because Himalayan salt is a good thing. And you need to brush it at the gum line. I have a little paper, 4 steps how to clean your mouth. I would be more than happy for you to send that to anybody that is interested. It has some pictures, shows how to brush correctly with a toothbrush, how to clean in between the teeth with these little, very soft picks called Easy Picks by a company called TP, which are silicone. They're very small. They make them small enough that you can use them with the child's mouth. I explain how to clean the top of your tongue with a spoon. You don't have to get anything fancier than that. And removing the unhealthy dental plaque is good. But you need to understand dental plaque is healthy until it's not. And that is a critical statement that is not understood, because to use products that destroy the dental plaque, this biofilm, continuously 24 hours a day is extremely unhealthy, and I'll tell you why.
Yes, please do.
And
yes, we want that handout, by the way. I'll put it in the replay for everybody for sure.
Yes, I will make sure I get it to you.
Okay.
Now, the tooth is unique. It is the only area in the body where a hard structure penetrates the soft tissue, the gum tissue, and it enters a sterile environment called the bone, the jawbone, and it's lodged there. So if there was no protective mechanism there to begin with,
oh dear, we're frozen.
that would be unhealthy. Could slide down this tooth, get into the sterile bone, and destroy the jawbone. If we didn't have methods to protect that very tenuous area where the tooth penetrates the gum, then we would have infection all the time. So how do we do that? The body created a biofilm called dental plaque. And the dental plaque is made up of several hundred species of bacteria, and it provides three major functions as it sits around this tooth gum margin. Number one, the bacteria produce hydrogen peroxide that kills off other potentially harmful bacteria in the mouth from getting into this tooth gum margin to slide into the bone. It also has chemical buffers that create a balance of acid so that it doesn't demineralize or decay the root of the tooth. So it's protecting the tooth from actual decay. In addition, it acts like a gatekeeper where the minerals in the saliva that can get into the tooth structure, it goes through the plaque, and the plaque allows these minerals to remineralize the root surface 24 hours a day, 7 days a week. This is a very important structure. So if you use chemicals that actually destroy the formation of this plaque, you're exposing this very tender area to all kinds of damage. Now, there are other things under the gum that protect the bone, but still the initial protector is the dental plaque. And we know that if we look at animal skeletal jaw remains or human skull remains from 10 or 20,000 years ago, there are signs that there are areas of dental plaque, because we can see the calcified tartar between the tooth and the bone, but there's no or very minimal bone damage of the jaw and minimal or no tooth decay. And these are like I said, 10 to 20,000 year old jaw remnants.
Okay.
So this is a very important structure that we only want to keep clean, but we don't want to sterilize and remove all the time.
Yeah, but we're being told in conventional dentistry that we want no dental plaque. Look at this
Absolutely.
plaque. I remember, I took my son to the dentist one time, and he's got braces right now, and this is not long ago. And they got in there and they scraped it up, and they were showing it to him like repeatedly. He's like, you see this? You see this? You're not brushing properly. You shouldn't have any of this plaque on your teeth at all. And of course, freaked him out. He's like, well, I'm brushing. I mean, so where is that coming from? Why don't more dentists talk about this, for the protection of the plaque?
Well, a lot of dentists want to remove the dental plaque 24 hours a day, 7 days a week. And not only do they teach you to clean your mouth, which is correct, you're not going to remove all the plaque all the time. And even if you did, it reforms in about 12 hours. But they're using toothpaste that have chemicals that prevent the dental plaque from forming. Xylitol is one of the examples, which is very, very common. There are other chemicals and mouthwashes that will prevent the plaque from forming. It is a concept that is incorrect. And there are And one of the things that I'm trying to do is get the story right. There are many medical papers that prove what I am saying is correct, but to get the medical knowledge into the clinical practice is not an easy thing, as you know.
Yes.
And the true biological dentist understands that dental plaque is your friend. Unhealthy dental plaque is not your friend. And the bacteria in your mouth is your friend unless it becomes unhealthy, imbalanced with very unhealthy growing bacteria. Sometimes when there's a lot of infection, we need to use an antimicrobial mouthwash or even an antibiotic to get the bacteria under control for, in 7 to 10 days. But we need to restore this healthy microbiome, this healthy garden of bacteria, not only in the mouth, but definitely in the gut. That has to be part of the treatment plan. We must make sure that we regrow the healthy bacteria and not destroy it daily.
Right. So okay, let's talk about bad breath for just a second here.
Yes.
Does bad breath come from the gut or does it come from the mouth?
Well, it certainly can come from the gut. Obviously, if you're eating certain foods and gases are being expelled, it can come all the way through your mouth and even your nose. And those odors are going to be emanating from your body. But the majority of bad breath that comes from your mouth, not from your air that you're breathing out, but from your mouth, comes from the top of your tongue. So the studies have shown that about 80% of bad breath comes from the gram-negative bacteria on the top of your tongue as it is destroying and metabolizing, breaking down other food particles. However, that gram-negative bacteria is actually very critical for certain biological functions. So if you use an antimicrobial mouthwash every day, you won't have bad breath. You'll kill all this gram-negative bacteria, but also help to cause high blood pressure in your body because you're not allowing a very natural biological pathway that makes nitric oxide in your gut from the saliva. So you need to not kill this bacteria. So how do you prevent the bad breath from a tongue? The way you do that is to clean your tongue. And here's how you do it. Take a teaspoon, invert it, put it all the way back on the top of your tongue just before you want to gag, press down and pull it forward. And do that 2 or 3 times a day or in the morning, and then do 2 or 3 times in the evening before you go to bed. You'll find that there's a milky fluid that's accumulating in the bowl of the spoon if you look at it. Obviously, you're going to wash it off or throw it away. But if you want to be a little daring, put it on the top of your hand, let it dry, and take a whiff. And that's what your bad breath smells like. I know. Well, come on. You need to do a little bit of testing to get motivated while you want to keep it clean. So this is a good way, an effective way, a very efficient way to remove the bacteria and the decaying food particles and dead bacteria, as a matter of fact, from the top of your tongue that's causing the bad breath.
Okay, totally makes sense. All right, so just as a reminder, everyone, if you're in the webinar room with us, all questions have to go in the Q&A. We're going to get to those in about 5 minutes because I see there's a lot of them, but I'm not going to be looking in the chat for questions, so please put in the Q&A. But I do have a question for you, and I love, you know what I love about interviewing experts like you is I get to selfishly garner information and good education for my own personal things that are happening here, right? That's one of the perks of it. But I know that there are other people out there that have kids that are teenagers, maybe a little younger, that have yellowing of the teeth, right? I have noticed this on my friends' kids. I have noticed this. My kid is concerned about it. Why do we see so much yellowing in our younger kids, in our kids?
Well, it depends on what really is biologically happening. If the coloration of the tooth is coming from the inside of the tooth, it could be tetracycline staining if a person was on tetracycline as a baby or a child and it's actually been incorporated in the structure of the enamel. That's a possibility. Excess fluoride in the water can cause a staining of the teeth internally. If there's excess iron in the water, it could actually cause some staining in the tooth. But a lot of staining, of course, is the type of food that you're eating. So there are some very, very simple ways to remove superficial stain on the tooth. And that would be to use baking soda. So you could take some baking soda, Baking soda is not caustic, but let me just explain how you need to use it, because if you use it incorrectly, it could be caustic. So baking soda is great because you can brush your teeth with it, because it is going to neutralize any excess acid in the mouth. And it also helps to remove stain on the surface of the tooth. Now, if you have a lot of stain, what you could do is take a slurry of baking soda, put some baking soda in a little bit of water, make a real thick slurry, and brush it with a soft bristle brush in the area of the teeth that look like they're stained. What you have to be careful about, and you can do it in a circular motion, what you have to be careful about is that you don't want to get the baking soda in this very thick consistency under the gum tissue, because if you're rubbing the baking soda where the gum meets the tooth, it will irritate the gum because it's so highly concentrated. But if you're only using it on the tooth colored part of the tooth, the white part of the tooth, when you smile, that part of the tooth that you look at, and you, in circular motions on the surface, you just kind of scrub this baking soda and then wash it off, you will actually get a whiter looking tooth.
Okay. I remember doing that as a child. I remember using that.
Interestingly, you could take that baking soda and crush some fresh strawberries into this thick mixture and do the same thing, and you'll get a little bit better whitening, because strawberries have malic acid, which actually enhances the ability to remove the stains. So you might want to try that.
Yeah, I'd heard about that. And someone actually told me she rubbed strawberries on her teeth. This was like 10 years ago. And she's like, oh yeah, because she had the beautiful white teeth. She's like, I rub strawberries on my teeth. I'm like, okay, so there we are. Yeah, I remember that. Okay. So I think it'd be a good idea right now to start on some questions on the Q&A. I know there's going to be quite a few. I see quite a few questions. So Sheena is asking, what are your feelings about gum grafts? Good question.
Good question. So, I will be a little controversial and tell you most gum grafts are unnecessary. So when you have receding gums, you have to understand why you have receding gums. If you have active gum disease, it will cause inflammation or infection under the gum, damaging the jawbone. And when the bone disappears, and the bone between the gum and the chewing surfaces, the cheek surfaces of the teeth, is extremely thin, almost tissue paper thin. So if that bone melts away, there's no scaffolding to hold the gum tissue in place, and it can shrink away and cause what looks like recession. Sometimes you're born with none of this very, very thin bone on the surface of the root of the tooth, genetically, congenitally. So if that's the case, and you're brushing aggressively, and there's no scaffolding to hold that gum in place, aggressive toothbrushing can cause the area to recede. Sometimes if you grit and grind your teeth at night, if you're wiggling the teeth back and forth, it is possible that it's going to break down, again, this very thin film of bone. And if it breaks down, the gum tissue is susceptible to breaking down and receding. So, or if you have orthodontics done and the teeth are moved quickly, too fast, they can break down the bone, which never grows back, and you can get recession.
Yeah.
So once the gum recedes, if the root surface is not sensitive and there's no active decay and the gum is not infected, there's no reason at all to do a gum graft other than cosmetics. Because the gum has nothing to do with the strength of the tooth. The only reason the tooth is strong in the jaw is because of the jawbone.
Okay, so you can't regrow gum tissue though, is that true?
No, you can't. I mean, if it's very inflamed and you clean it properly and get the inflammation away, the gum may regain some of its height, but it will never grow by itself all the way to where it used to be, because there's no bone. Once the bone is gone, it's gone.
Okay. So we've got a question. When we get our teeth cleaned every 6 to 9 months, can we request another treatment to replace the fluoride treatment? I guess maybe she's asking, would there be a beneficial treatment to replace fluoride, or maybe just avoid the fluoride would be?
There's no reason to use the fluoride.
Yeah.
Especially if you understand how to clean your mouth, number one, and how to eat a healthy diet that is not including basically the added sugars as well as grains, because grains have phytates, and phytates bind to minerals, which is important because minerals help to remineralize the root of the tooth.
Right. Yeah, absolutely. Okay. So RC is also asking, and I believe I remember talking to you about this before. Can you brush your teeth? And there are two people are asking the question with hydrogen peroxide. And I remember telling you I had bought this spray that I occasionally use like once every couple of months. And you said never use that on a daily basis, but I don't remember why.
Well, hydrogen peroxide is an antimicrobial. Not only is it an antimicrobial, it doesn't kill fungus. So people that use hydrogen peroxide on a regular basis are killing a lot of good bacteria and allowing yeast to grow in their mouth. And sometimes they get a yeast infection in their mouth because they're using hydrogen peroxide. I would never, ever recommend hydrogen peroxide on a daily basis. But if you have infection in the mouth, maybe using a dilute amount of hydrogen peroxide, like 1.5%, which is basically half and half of a normal 3% bottle of hydrogen peroxide. You can swish maybe 2 or 3 times a day for a week or so to help heal and oxygenate the tissue, which is what hydrogen peroxide will do. But you need to restore the healthy healthy oral bacteria as well as the healthy gut bacteria.
Okay.
But
so,
I would never use it regularly.
Yeah, RC is saying, what does the fluoride do exactly in layman's terms? I might have scooted off you said you're replacing the ion and all that, and I went into the receptor. So let's kind of backtrack a little bit and do some real quick.
It can damage iodine, which is part of the thyroid hormone, and it can replace the iodine with fluoride or fluorine, and it is unhealthy because the hormone will not work because it's not constructed chemically the way it should be.
Exactly.
It also affects the development of nerve tissues, and it can decrease an IQ of a child because it is neurotoxic, meaning it is unhealthy and toxic to nerve tissue. And those are only a few of the damaging effects of fluoride. If you look at on Google the unhealthy effects of fluoride, you'll be impressed with what's going on in there, especially if you look up in PubMed, which is a government resource for medical literature. You'll find all kinds of articles about it.
Yeah, fantastic. Okay, Joni is asking, what about chewing gum? I have digestive issues and chew a lot of gum in the evening. I chew Trident, which is so bad for us. I bought some Mighty Gum this week at the biohacking conference. Any other healthy gum that you know about?
So the problem is...
Yeah, she says she chews a lot of gum for digestive issues, which we got to find the cause of digestive issues so we don't have to chew the gum, right?
Right. So we're dealing with some type of unhealthy growth of bacteria in the gut, which is called dysbiosis. We need to use correct spore-based probiotics to restore the gut and a few other things. But gum, you have to look at the ingredients in the gum. If it has sugar alcohol, which most of them do, it's either sugar alcohols, which are xylitol and erythritol and those kinds of sorbitol. All of those sugar alcohols are very upsetting to the gut. So if you've got a problem with the gut, that's only going to make it worse. Right. And if it's not sweetened with that, it's going to be sweetened with other artificial sweeteners that are even more damaging to the gut bacteria, or it's sweetened with sugar, which is totally congruous to a healthy mouth. So gum is not the ideal.
Right. And why did they start, and I remember reading about this, why did they start promoting xylitol as a healthy ingredient for toothpaste? Was it because...
Well, it kills bacteria, and it helps to prevent dental plaque, and the idea is that dental plaque causes tooth decay. That's true when the dental plaque is unhealthy. Right. But not when the healthy dental plaque is around the mouth and the diet allows the gut microbiome to be healthy and the oral microbiome to be healthy.
Right, right. Okay. What is your opinion about oil pulling first thing in the morning, or oil pulling in general?
Well, oil pulling is an antimicrobial. So if you did oil pulling for a week to 10 days because you have some irritation in the mouth, that's fine. If you do oil pulling on a daily basis, you are removing the healthy microbiome, the healthy garden of bacteria. I had a friend who did some research, and he was looking at patients, actual patients. He was a dental researcher, and these patients were doing oil pulling for years, 20 minutes of oil pulling every day. And he evaluated and cultured bacteria in the mouth, and he couldn't find a normal growth of bacteria in these patients' mouths.
Wow.
So you can, you know, you can kill all this bacteria that's bad, but you're killing all the good stuff too. You know, if you have some ants running around in the house, you could get rid of the ants if you burn down the house.
Right.
But that makes no sense, right? You need to address what's causing the ants on the floor without burning the house down. So
Yes.
if you have a problem with bacteria in your mouth, let's address why the bacteria are there. Let's seclude them and get the healthier bacteria to grow that will reduce the concentrations of the unhealthy bacteria so that we don't feed the unhealthy bacteria any longer.
Yeah, 100%. Okay, a lot of commercial mouthwashes claim to be antiseptic. What is that for? Obviously. I mean,
yeah, so antiseptic is antimicrobial. Basically what it means is it's going to kill the bacteria and make your breath smell fresher. Yes, it will do that, but with great harm if you're using it on a daily basis.
Yeah, antiseptic just sounds like a hospital floor product or something. I don't want that in my mouth at all.
Sure, it's yeah.
Okay, Linda's asking, I drink turmeric daily in my greens and it discolors my teeth. Best methods for removing those stains, I think we already touched a little bit on that. But she says her dentist believes it's deeper in the teeth, but it doesn't seem to be helping for baking soda. So what you said earlier.
Yeah, so anything that's internal to the tooth structure, the enamel and even the deeper dentin structures of the tooth, you will not be able to remove the stain at all.
Okay, what about charcoal? Charcoal toothpaste, charcoal, tooth powders.
Well, I don't agree with charcoal or bentonite clay. My recommend, because these are binders. Some people say it only binds to the bad stuff. Well, I don't believe that. The binders bind to the minerals in your food. And if you're using, or in the saliva at the moment, so if you're using these kind of elements, you're removing minerals that are necessary. You just don't know that you're doing it. And if you want to try to whiten your teeth, use some baking soda.
Yeah, yeah.
I don't recommend the charcoal at all.
Yeah, okay. Are electrical toothbrushes okay?
Absolutely, I love them. I'm lazy. It's perfect for me.
Me too. I've got 2 of them. When one dies, I've got a backup. Okay, here's the good question. So what do you do if your dentist says you need a root canal?
Yeah,
I've heard that too many times.
It's a great question. So I will tell you that if you need a root canal because you had a traumatic accident and you broke your tooth in half, for example, and the tooth is vital, meaning all the structures in the center of the root, the blood vessels and whatever are living tissue, no infection, you might be able to have a root canal and it might be successful, because a root canal means you have to remove all this living material in the center of the tooth and put a filling in called a root canal and then build it up with a crown or something to create normal function. That's not a guarantee, but that's probably the best way to get a possibly good result for a root canal. Most root canals are done because you have an abscess. The tooth has decayed, the infection got into the nerve of the tooth is dead, all the tissues are dead, and infection is pouring out the base of the root and even the sides of the root into your jawbone. The root canal theoretically cleans out the infection and sterilizes the root and allows the tooth to be restored for function. The problem is biologically, most likely that infection has never been removed because it's all microscopic and it's still leaking through the very tiny pores in the root into the bone, creating an immune response, creating infection or inflammation into your bloodstream and causing other chronic diseases. And it doesn't have to go directly into the bloodstream. It can seep into the lymph in your body that eventually gets into the bloodstream. And most interestingly, which is not understood very well, is the inflammation and the infection can get into the nerve sheath. This is the covering of the little nerves all over your body, in all of the bone structure, and travel to every other part of the body, not in the circulatory system, but through the nerve canals. It probably is very similar to the concept of the dental meridians and how it affects different organ systems, because these nerve canals go to any and every part of your body.
Yeah, like a kind of like a telephone cable wire, the little
Yes.
plastic coating on the outside is
Yes.
the
A
sheath, the
great
inside is the
example.
nerves. Yeah.
Yep.
So yeah, thinking about that, you guys, when we talk about the myelin sheath, it is that plastic coating, so to speak, on the telephone wire, and the inside is the actual nerve. So it's a protective sheath, right?
Yes.
Yeah.
So to answer your question, in my opinion, this is very controversial. In my opinion, a tooth that is abscessed with infection into the bone ideally should be extracted correctly and replaced, if necessary, with either a partial denture that goes in and comes out, a bridge that's cemented on the two adjacent teeth to the space, or an implant that goes into the bone like an artificial root, and then a cap is put into the implant and it functions naturally. And if you're
Yeah.
going to use an implant, the material should be zirconia and not titanium,
Right.
because titanium has been shown to create an immune response in your immune system that
Hmm.
creates systemic inflammation. So
Yep.
you should use zirconia, a ceramic-based zirconium dioxide implant.
Yep. And you, like I said, you saved me on that, because I have had multiple problems with my teeth because of a very, very bad dentist, and that saved me. So I've had it. I've had all of that done. I've had the root canals, I've had the bridges, I've had the crowns, and now I've had the implants. I'm working my way through, right?
Yeah.
It's not a person. And here's the thing I want to share with everybody too, you guys, we're having real conversations about real things here that people are dealing with all the time. And, although we have to remember, we're all very self-conscious about the ways that our mouth looks, and mine certainly isn't the way I would like it to look, but what's more important to me is what's going on inside of my body. So when getting an abscess tooth taken out or a broken tooth out, and avoiding the systemic inflammation is more important to me than what my teeth look like when I smile, right? I want to stay healthy from the inside. So just, we got to put some of that stuff to the side and do what's best for us. So if getting a tooth pulled sounds like really extreme to you, think about what your body's going to feel like when everything starts breaking down on the inside if you don't.
Well, just think about if you had a splinter in your finger,
Mm-hmm.
no matter how healthy you are, and let's say you're the healthiest person in the world, that splinter is still going to cause inflammation and infection where the splinter is.
Yes.
The only thing that will heal that area is to remove the splinter.
Right.
And if you were not smart enough, after you removed the splinter, you took the splinter and just stabbed the puncture wound every day, that puncture wound could never heal because you're constantly irritating it. So
Yeah.
if you have a splinter in your mouth, let's say a dead tooth, now it's a dead tooth. It's not part of your healthy body parts any
Mm-mm.
longer.
Mm-mm.
If that splinter is an irritant, no matter how it's an irritant, it needs to be removed from your body or you can't heal. Most functional medicine practitioners who try to heal the body, even physicians in their conventional way that try to heal the body, and they're not getting results, many, many, many times it's a result that there is something in the gum tissue or the jawbone that is acting like a splinter, creating systemic inflammation. I wrote a paper that talked about the 14 hidden splinters in the mouth. I'll get that to you if you want to.
Love it.
And that will give people an idea of the potential problems that you may not feel that are affecting your immune system, because everything is based on a healthy and robust immune system. So
Yeah.
if it's affecting your immune system and creating inflammation, even if it's not causing harm, pain or swelling or visible harm, it could be damaging to other organ systems in your body, creating systemic diseases and chronic diseases that we're experiencing today.
Yeah. Yep. Okay. Beth is asking, are water picks good? Do you like water picks?
No, let me tell you why.
Okay.
Generally, no. Sometimes, maybe yes. The idea of a water pick makes sense. The water pick is a jet of water at a high speed that washes something away. Just like if you had leaves on your balcony and you took a leaf blower, you could blow all the leaves off your deck and everything is beautiful. However, think about this. Think about if you had a leaf blower on your porch and you angled it towards a corner of your deck, and all the leaves at the right angle now packed into that corner, and it got deeper and thicker. So now let's think about the leaf blower as a water pick. If you're using the water pick and you're trying to remove junk that's under the gum tissue, you're using it under the gum. And most people say or think that if it's a higher pressure, it's going to do a better job. So water pick devices generally are calibrated to 0 to 10. So you want to use, or you'll think you want to use a 7, 8, 9, 10 pressure, and you're going to angle it around and under the gum. Theoretically, it should wash everything away. But if you did it at the wrong angle, which you don't know that you're doing, and you got under the gum just at the improper angle, you're packing food particles that are decaying and dead bacteria as well as living bacteria deeper under the gum. So under the gum, the space narrows like a funnel. So what is kind of floating in the top surface of this funnel gets packed deeper and more difficult to remove deeper into that pocket, and you're literally potentially creating abscesses. Now, if everything worked well and you actually did not impact food particles and dead bacteria deeper under the gum, if the area needed to be healing because there was some problems and you're using this sharp water spray, you will be cutting the epithelial cells that are trying to heal constantly. Just like if you had a scab on your finger and you keep picking it, it won't heal properly. So if the gum underneath the pocket is trying to heal, but you use this sharp water jet constantly breaking up the cells that are trying to heal, it'll scar over and create a defect.
Wow.
So I don't like water picks.
Goodness, that was a good explanation. I'm going to put mine back in because I just charged it last night. I pulled it out of a drawer this week and I was like, wow, I haven't used this in years. I wonder if it still works.
In my paper about the 4 ways to clean your mouth, I talk about water picks and how to avoid that kind of a problem. If you're using a water pick, just because it feels fresher, make sure that the jet pressure is like 1, 2, 3, or 4. It won't do a whole lot of good, but it may make it feel fresher to you, and that's fine because the speed of the water jet is what's damaging. So if it's at a 7, 8, 9, 10 intensity, it's very unhealthy.
Okay. We have a lot of questions. So you guys, this is what I'm going to do. First, I'm going to ask you, Dr. Al, can you go another 15, 20 minutes or do you need a hard
I'm
stop?
good. No, I'm good. I'm good.
Awesome. Okay. So I am going to avoid any toothpaste questions, you guys. We've already answered that. And anything I feel like is repetitive, I'm just going to scoot off here. But Mercedes is asking, are you familiar with Deoxybrite, active chlorine dioxide? And is that okay?
Is that a product that is marketed? I'm not sure.
Okay, yeah, so I believe so.
I'm not sure, but I know it's chemicals here. And the purpose is what? Is the purpose to harden the root of the tooth? Or is the purpose to remineralize the tooth? Is the purpose to kill bacteria? None of that makes sense to me because these are all chemicals on a daily basis that are harmful.
Sounds good. Yeah. And speaking of remineralizing, Jane is asking the question, can you speak to hydroxyapatite?
Oh yeah, hydroxyapatite.
Thank you.
So let me tell you, this is controversial also. So a number of toothpastes, you're going to get a lot of phone calls. Nobody knows my phone number. That's good.
I'm not giving it out.
No, actually anybody can email me and I respond to all my emails. But let me just tell you, this is controversial and I will tell you the research. Many toothpaste companies have good intentions and they're not putting, especially the holistic organic type toothpaste that you can buy on the market or the internet. They're not using fluoride any longer and they're using hydroxyapatite to harden the roots of the teeth. And they're using what's called nanohydroxyapatite. Nanohydroxyapatite are absolutely small microscopic particles of hydroxyapatite, thinking that it is a great way to remineralize the tooth. And some of the research suggests that it is. But the most recent research shows that nanohydroxyapatite, as well as other nanochemicals that are used in the mouth or in medicine, actually get into other cell structures because they're so tiny, they're damaging the DNA of our cells. They are what's called cytotoxic. So I do not recommend any products that are nano products used in the mouth. And nanohydroxyapatite if you read the new toothpastes, are used, and I believe they are potentially very unhealthy, and it will take another 10 years before we prove that that's damaging the human body in a large extent. But the science is there. People can not Google, but go to PubMed, type in nanohydroxyapatite, cytotoxic effects, and you will see maybe 7 or 8 articles that were published in the last year that proves that it's cytotoxic, not just the mouth, in kidney tissue and almost any human cell structure that it penetrates.
Wow. Okay. Good information. All right. I'm going to combine a question here. So is daily flossing recommended, and how do you feel about HydroFloss?
So daily flossing is recommended as long as you don't floss under the gum tissue, because there's no reason to try to floss under the gum tissue. Most people that try to floss under the gum literally cut a cleft into the gum. It hurts for the first day or two, then it doesn't hurt anymore, but it's healing in a sharp cleft that harbors bacteria and other decaying food products. But flossing is great to remove fibrous foods that are stuck between the contacts of the teeth, but not under the gum. To clean where the gum meets the tooth between the teeth, use these little TP Easy Picks, which are fantastic.
Yeah, so I'm going to get a link for that from you as well. But
yeah, that's on Amazon.
Yeah, isn't that interesting how the dentists, like, you know, the hygienists, they like to show you how to floss by going under the gum in a U shape and all that. And I always said that doesn't feel good to me.
Yeah, well, you're going to cut the gum.
Yeah, exactly.
It's very difficult not to cut the gum.
Okay. All right. Catherine's asking, after an infection and 10 days of mouthwash, how do you replace the healthy bacteria?
Oh, absolutely. That's a great question. Number one, you need to start with the gut microbiome, because that's where it all emanates from. And what we need to do is address why you have unhealthy gut microbiome. It could be diet, so we have to address the diet. If the gut microbiome needs repair, we need to actually use spore-based probiotics. They're the only probiotics that resist the stomach acid and get into the gut to regerminate themselves and repopulate your natural microbiome, or your garden of bacteria. Your garden of bacteria in your gut is as unique to you as your fingerprint. So I'm not going to tell you this bacteria species and that bacteria species are critical for your gut. What we know is that if we can germinate spore-based probiotics, which are spore-based bacillus bacteria, and that makes all kinds of chemicals that are healthy for the gut, it stimulates your own friendly bacteria called commensal bacteria to grow in larger numbers and kind of weed out other potentially bad bacteria. And once the good bacteria is in place, all mucosal tissue, all tissues like soft, moist tissues, the mouth, the mucosa of the throat, every soft, moist tissue communicates with one another. So all the bacteria in the gut talks to all the bacteria everywhere in the body, and it makes the bacteria in the mouth potentially healthier because it supports the immune system as long as your diet is healthy. If you're eating unhealthy foods that are damaging and inflammatory to your gut, you won't be able to sustain a healthy microbiome. Do that in the gut, the mouth automatically improves. And there are great human studies that prove change the diet and the bacteria in the mouth change accordingly.
Right. And I will be bringing in a spore-based probiotic expert, you guys. I'm going to be bringing in one of those interviews in. So always sign up for future events. Please keep your eyes on that.
That sounds like a good one.
Oh, it'll be a good one. I've been loving those spore-based probiotics for many, many years.
Oh, yeah.
Just like eating a carrot out of the dirt in the garden. If you've got an organic garden and no toxins in there, well, you know, it's not going to hurt you. It's only going to help you. So how do we address periodontitis then?
Sure. So periodontitis is a different problem now. Okay. So interestingly, there was a study published in 2010 that showed, it's amazing now, 94% of the US adult population has some form of gum inflammation or gingivitis. 94%? That is epidemic, more than epidemic.
Yes.
So, you know, when you look, I'll give you an example for us. As a woman, you're putting on your makeup. A guy is shaving. That you're looking in a mirror. If you saw a drop of blood coming out of your ear, would you be concerned?
Yeah.
Obviously.
Right.
or a drop of blood dripping out of your eye or your nose, you're concerned. But why are you not concerned if you're brushing and you spit in the sink and it's pink, or you're flossing and it's pink, or your toothbrush is pink after you've brushed? Why are you not concerned? Well, part of the reason is it's normal, only because almost everybody has bleeding gums of some type at certain stages. You go to the dental hygienist and you think your mouth is healthy, and you tell or ask the hygienist, tell me how my gums look. And she says, oh, they look great. There's just a little bleeding in the lower molar area. A little bleeding is infection. You got to understand that. So periodontitis is a serious gum disease where gum inflammation, this bleeding of the gum, penetrates under the gum, and doesn't always happen, but when it happens, it can get deeper under the gum, changes the bacterial profile, and it starts to damage and melt away the jawbone.
Yeah.
That infection is called periodontitis, very infectious. 47% of US adults have periodontitis, and if you're over 65 years old, it jumps to 70%. That's the major reason for tooth loss and other systemic diseases, because the infection now gets into the bloodstream, or gets into the lymph that eventually gets into the bloodstream, or travels the myelin sheath, the covering of these nerves all around the body.
Yeah.
So how do you treat it? Number one, you need to understand the gut started the problem, but now that you've got the serious infection, even if you got the gut healthy, it's not going to stop periodontitis. You must treat periodontitis, and to do that, whatever is irritating under the gum needs to be removed, like deep tartar, but also the bone cells need to be restored, and the active infection needs to be brought under control. Generally, the best method conservatively would be a deep cleaning called a scaling and root planing. That's done by the hygienist. They numb the gum, they do a deep cleaning. It's not a cutting procedure. That sometimes works if there's not serious bone damage. But if there is serious bone damage and the teeth are maybe even starting to get loose, certain laser procedures have been shown, double-blind studies have shown that certain laser procedures, a certain wavelength of laser treatment, will actually kill the very virulent bacteria, but more importantly, it stimulates the bone cells of the jaw to regrow themselves, and we can actually regrow jawbone that has been destroyed by periodontitis. But what you need to do is make sure that you understand how your diet has to be changed, how your gut microbiome, the garden of bacteria in your gut needs to be restored, and repair the damage from the periodontal disease called periodontitis using a laser.
You literally just answered Carol's entire question in the Q&A. Literally, she has bone loss in her lower jaw due to this disease. 2 front teeth are loose.
Yes.
What do you think about laser? Like you
absolutely.
Yeah.
And so when I was treating patients, which I don't do any longer, I was using a laser procedure for about 7 years. I was getting bone regeneration like I never got for the first 30 some years of my career. So nothing has been effective as laser. Now, it doesn't grow all the bone all the time. There's a lot of factors, but I use a procedure or a protocol called Laser Assisted New Attachment Procedure, LANAP. It is a specific type of laser that is a specific wavelength. To use this laser, you have to be trained and licensed by the company. So you just don't take a weekend course and all of a sudden you're using this laser. But it is an extremely efficient method to regrow bone, regenerate the jawbone, and it's impressive.
That's really, that was pretty timely right there with that answer. Awesome. Great information. So Jean is asking, if you have a bunch of root canals in your mouth right now, what would you do at this point if they're not really bothering you? If something does arise, what's the first place to look for trouble? And another person asked kind of the same thing. Like, you know, I think people, there's a lot more root canals than we think, you know, people have a lot more of those. Ozone, is that helpful? That kind of thing.
No, ozone would not be helpful, basically. So generally, the areas need to be looked at and monitored. A regular x-ray, dental x-ray, is a 2-dimensional picture of a 3-dimensional object, and it doesn't always show damage around the bone structure that houses the tooth root where the root canal is. But that damage, if it's visible, is an indication that that tooth root canal is failing and that tooth needs to come out.
Okay.
One of the x-rays that is very beneficial, the x-ray machines that is very beneficial to look at this in a three-dimensional way is called a CT, a cone beam CT scan. Cone beam CT scan.
Mm-hmm.
And this is a three-dimensional x-ray that shows in 3 dimensions what is going on all around 360 degrees around the tooth root. And a dentist that has that machine can look at the area and see and determine if the bone is breaking down from a failing root canal. If it's not breaking down, then there's no problem. The sad thing is that it could be breaking down and there's no pain or swelling. Even if there's no pain or swelling on a failing root canal, but it shows on this CT, cone beam CT scan, that there is active demineralization or breakdown in the bone around the root of this tooth, that tooth should be removed.
Yeah, I had one of those CT scans done at one point to do a look at everything. I remember that. It's like it rotates around your head, which kind of leads us into a question about, you know, when we're doing scans and we're being exposed to radiation. Linda's got the question, you know, do you feel that the Panorex X-ray machines without thyroid shielding is okay? Supposedly they don't require them. And what are your thoughts about X-rays in general, besides the 3D?
All right, let me tell you, I'm back over 44 years also in a second. So let me tell you, low dose ionizing radiation causes cancer if it's used on a regular basis because it's cumulative. I'm not telling you not to use dental x-rays because that's the only way to see something that's invisible to the naked eye. But you need to be aware that you're just not going to have a CT cone beam CT scan every 4 months just to prevent a problem because you're going to get a lot of radiation. I have an interesting condition. I have incurable multiple myeloma. I was diagnosed in September 2018. I was given 3 to 6 months to live. My oncologist thought I was going to be dead December 2018. I rejected chemotherapy, doing amazingly well, and we can have another discussion how I'm doing it. But I will tell you that I tried to figure out why I have multiple myeloma. And there was a study, I'm very geeky, so I like a lot of studies. There was a study that was published with about dentists and cancer, and it utilized a cohort, meaning a group of male dentists my age compared to the general male population of dentists. And these dentists were 65 to 75 years old. And that group actually had an increased prevalence of cancer, especially multiple myeloma. The question is, why did they? And I tried to figure it out, and I believe I know the answer. 2 reasons. When I was in dental school for 6 continuous years, I was exposed to 2 things continuously. Low dose ionizing radiation in the dental clinic. These are x-ray machines that are going on off all the time. I didn't even realize that. We had no protection in those days. It's the early 1970s. And there is science that shows that low dose ionizing radiation creates cancer in plasma cells, which is what I have. The other thing is we used free mercury in mercury fillings, amalgam fillings. We played with mercury in our hands. We even threw excess mercury on the floor to look at the little beads of mercury dancing on the floor and evaporating, not knowing that it was evaporating in the environment of the dental school. All dental schools in the United States were the most toxic buildings in the early 70s. So I believe one or both of those things caused my plasma cell to become malignant. Eventually, it manifested to my disease in 2018. So a long story to tell you, dental x-rays can be harmful if they're used continuously, especially if you're using dental x-rays and medical x-rays. You're flying in airplanes every week because there's a lot of radiation in airplanes. All of this low dose ionizing radiation could be a problem. However, it's critical for a dentist to look at the bone and to protect your body. So you need thyroid shields, you need all kinds of lead shields so that the only thing that's exposed for the minute period of time that it's exposed is just the area of the jawbone that's being looked at.
Right. Oh, you're definitely coming back to talk about your journey and your experience, because I track you on Facebook and I message on, I watch you. We've got to have you back to talk about how you're doing so well. So
my protocols are unique, and I'm not cured, but my PET scan from May 8th, 2020 showed no active cancer cells in my entire body. My oncologist has no patient that has had my success, especially since I've never done chemotherapy.
yeah, it's crazy. Okay. You have to come back for that. We got to get close to wrapping up, and there's still a lot of questions. So I'm going to take a couple more. Let's be expeditious in answering. And let me just say this also, you guys, for those of you who are not in the health and wellness space or are not wellness professionals, this may seem a little bit overwhelming. Like, we're sharing a lot of information. I think we're doing a pretty good job of keeping it in general terms and helping you all to understand. Obviously, you can tell there's a lot more to health than just taking good care of your teeth, right? So if you don't have a health coach right now, watch the replays. I'm going to be sharing information for you guys to find a health coach who can get in here and help you with these pieces that Dr. Al's talking about, the gut biome, what you're eating, how it's affecting you. So let's not forget, how absolutely beneficial health coaches can be to your life. Okay. And if you're following a health coach and you're listening from their page right now, or you guys need to get in touch with them, they can make huge differences in your life in helping you get well. So let's go real quick on this. And someone's asking, so can you touch on clenching, tooth, mouth guards, and TMJ? Those three things.
Those are great questions.
Mm-hmm.
Some of the times, clenching and TMJ, meaning the jaw joint around the ear where the jaw opens and closes near the ear, can create a lot of pain and damage to the jaw bone itself that houses the teeth and wiggling of the teeth. Sometimes it's caused by sleep apnea, which is related to improper tooth position and not enough space for the tongue to swallow. Those are other factors that can be controlled. But some people grit and grind their teeth for a variety of reasons, not sleep apnea, and it creates weakening of the jawbone. It doesn't cause periodontal disease, but it weakens the jawbone. It can crack teeth. It can create pain in the ear area because of what's called the temporomandibular joint, or the TMJ. The muscles can go into spasm, and all kinds of other issues can occur. The simplest thing to prevent the trauma from grinding, I can't tell you that's going to stop it, but the trauma from the grinding is a bite guard. So the easiest way, the most inexpensive way to protect your jaw is to go to the drugstore where they sell toothbrushes and dental floss and look for these soft bite guards that you can put in your mouth. They look like a little horseshoe. There's instructions on how to fit it in your mouth. Generally, you would put it in hot water to soften it. Put it in your mouth, it'll tell you to bite into it. Then put it in cold water so it solidifies, but it's still rubbery. What they don't tell you, which I would suggest you do, is take a pair of scissors and cut off all the excess material that is lateral or beyond the actual tooth impression, so that it's not irritating your gum or your tongue, and sleep with it. Now, it's not going to stop you from grinding, but it's going to cushion the pressure, so it may prevent a tooth from breaking. It may prevent the pressure that goes to your jaw joint that creates pain, and it may help prevent the wiggling of the teeth because it's a softer structure. There are other dental guards that are made out of hard material that are more effective.
I have one of those.
But that needs to be done by a dentist that understands how to make a bite guard. And if the teeth are bumping unnaturally, sometimes the chewing surfaces of the teeth need to be reshaped or polished in such a way that the pressures are evened up when the upper teeth come together with the bottom teeth.
Yeah. I love my acrylic guard. I'm on my second one because my dog thought the other one tasted really good, and she ate it. $300
It's the most
guard.
expensive Buddha bone you'd ever give your dog.
Yeah, but I will share for everybody who's interested, I'm a grinder. It's one of the reasons why I probably had some teeth issues, and then when they got broken, it was just hell in a handbasket over here. It only covers my front teeth right here. The guard just covers the front, so I don't have any gagging. I don't have any of this crazy back and forth business. It just keeps my teeth apart. It's fantastic.
Okay, so let me mention this. I can't remember the name of that little appliance, but it's only around the front teeth, right?
Mm-hmm.
So here is a potential problem. I don't want to give you something to worry about, but this is why I don't like those.
Yep.
When you're sleeping with it at night, it is very small. Theoretically, most of the time not, but theoretically, it can dislodge and you can swallow it.
Oh, I can see how that could happen.
And you can aspirate it. And that
well, it's not that small. It covers from there all the way.
Oh, that's a different story. Some of them are made only for the 2 front teeth.
No,
that's
it's
a different story.
It's 4. Like
okay,
1, 2,
that's
3, yeah.
Yeah, that'd be 6 from cuspid to cuspid. Okay,
yep.
That probably is not going to be a problem. The ones that are made with only the 2 front teeth are very easy to aspirate and you'll suffocate.
Yeah, that's kind of scary. Okay, we got to wrap up, you guys. There's so many questions here. I'll tell you what, let me just say this. Yes, I'm going to answer real quick. Yes, we will get a replay. I will email back and forth with Dr. Al about some of these other questions, how to find someone who does laser, how do you find a holistic dentist, you know, what your thoughts are about ozone therapy. We'll do a little back and forthing and I'll get some of that copy and I'll put it in the replay and share that with you guys. I also just want to reiterate, you guys, Dr. Al does consultations and he works from home. And you don't necessarily have to see somebody in person, as you can tell from all the amazing comments we're getting about bringing you into this space. Just doing a consultation with Dr. Al will probably give you more information than you'd ever get from a year of visiting your own dentist. So please consider that. Having, you know, the dream idea for anyone that's concerned about dental health would be get a health coach to talk to you about your food, your sleep, your movement, your stress, your trauma, all of the things that can cause grinding and problems with the gut. And then book a consult with Dr. Al or look at what he can do to help you understand your own unique problems and get a consultation to, you know, to get some guidance so that you can have an educated conversation with the dentist that you actually see, even your oral, you know, your hygienist as well. So I just want to throw that out there as well. Dr. Al, I'm going to be sharing your information on how they can get in touch with you, as well as the links to your books that you've written, and getting the guide from you. So that's like a real fast recap of all the great stuff we're going to provide for you guys.
Well, let me just mention, I have over 500 of my articles on my website that all you need to do is search for it. So if you went to my website, which is drdanenberg.com, and you just put in the search little box a word that you're looking for answers to, like implants, for example, all of the articles that I've written about implants will pop up, and they're all available to you. Everything I write, I support with peer-reviewed literature. So it's not anecdotal unless I tell you it's my own idea. But there's a lot of supporting information on these articles. You can download those articles. They're always available to anybody for all the time. So it's not a problem.
Yeah, sit down with something and get comfortable, because that's a resource library that will definitely take you down a rabbit hole of learning. It's all very valuable. So I appreciate that offer as well. So, all right, Dr. Al, I'll be reaching out. My team and I will be in touch to get you back on here to talk about your journey. I want to know everything you're doing to look so vibrant and healthy and to feel so good. You know, I just want to say this. Your information following your story has been very inspirational for me, and many of my coaches are mentioning that as well. So thank you so much for being vulnerable and open and sharing all this great information.
Thank you. You're very sweet. I appreciate it.
All right. We'll see you again soon. Thanks for all of the great questions, you guys. Watch for the replay in the next 48 hours, and we'll see you again. Dr. Al, thanks again, everybody. Have a great day. Bye now.